continues. Once again, John Stossel.
Many people say the problem with our health system is greed. Businesses shouldn't be making money off sick people, right?
$139 billion in windfall profits. Ooh.
Medicine shouldn't be about profit, and he say it should be about caring for people. Then Vicky wouldn't have to be so scared.
What's going to happen to me if my cancer comes back?
How will I pay for it?
Who's going to take care of me?
The intent is to maximize profits.
It's why we've got to have government health care, says Michael Moore.
Get the profit out.
Get the profit out, get the private health insurance company out of there. That's right.
Government will do it better, he says. Heck, the post office delivers his father's Social Security check on time every month.
But mailing his check is simple. Healthcare is complicated. I don't want my healthcare to be like the post office with long lines. I want FedEx.
Relax, it's FedEx.
It's easy to make profit a dirty word.
The profit model is denigrated and dismissed as evil. But when Henry Ford came around, cars cost more than houses. He said, I can make it better and cheaper. In 8 years, he cut the price of a car by half. There are Henry Fords in healthcare. They're great doctors, great scientists, great business people.
But they have less incentive to innovate without profit. Government-regulated phones were once all black, rotary dial. Competitors seeking profit is what has given us the choices we have now.
Hello? Cell phones get better and cheaper.
Did you say better?
Cell phones are better than the old black phone I used to have.
I couldn't get a signal, you know, between here and Columbus Avenue.
Aren't they better?
In fact, you know what I say to people? When are they going to invent the cell phone? Because I don't know what these are. Well, now I know, I watch your show, and I know.
You want government cars? I mean, you remember the best the planned economies could produce? That was the Trabant. It was awful. I was going to show you the picture.
He didn't remember the Trabant, so I showed him a picture. It was that East German car.
A Trabant is a two-stroke 600.
It was so primitive, just filling the tank was a hassle.
You have to use gasoline and oil, mix it together in here, and you shake the car back and forth to mix it together.
This was the best that governments could produce.
They're horrible. Are you kidding? Don't even use those as examples.
That's what happens when government produces things.
I understand why some people don't like the government running things now, but the government used to be really good at things. We did things like defeat the Nazis.
Well, yes, some things we want government to do, like fighting wars. But government rarely does things efficiently.
The private sector does everything better because they compete.
Private sector does everything better? You are like so 13th century. I love this.
He can laugh at me, but it's people competing for profit that's lifted us out of the 13th century and given us 21st century medicine. Drug companies looking to make money, create things that improve our quality of life and save lives.
Frankly, without Bristol-Myers Squibb, I wouldn't be here.
Profit drives innovation, says Grace Marie Turner.
I want companies to come up with cures for Parkinson's, cures for cancer, cures for Alzheimer's. Unless there is a reward for them to do that, we're not going to have those new medicines.
Well, government has researchers. We have the NIH.
Government is responsible for 4% of the drugs on the market today.
Those expensive cancer drugs Vicky needs, they were made by companies looking to make a profit. So were these amazing artificial legs and artificial hearts, all invented for profit, as was Shirley's American surgery.
The idea of somebody profiting, who cares? I'm alive, and I really don't care. That's the only part that's important to me.
And every year, thousands of people from countries with government health care make that calculation. When they can, they come to America for treatment. The famous Spanish tenor Jose Carreras didn't get treated for cancer in his home country. He went to Seattle. King Hussein of Jordan came here. So did this sheik from the United Arab Emirates. This Italian prime minister.
Hello, you lovely little children.
Archbishop Desmond Tutu, and many others.
This is the country of medical innovation. This is where people come when they need treatment. Literally, we're surrounded by medical miracles. Death by cardiovascular disease has dropped by 2/3 of the last 50 years. You got to pay a price for that type of advancement. Dick Cheney has had 4 heart attacks. He's not only able to walk up a flight of stairs, he can hold down full-time employment. 50 years ago, he would have been spending a lot of time lying down with his eyes closed. That is the miracle of modern medicine.
A miracle made possible by profit.
When 2020 returns, a whole new idea. Employees bargain hunting for health care.
They didn't ask what things cost before. Why should they? Somebody else is paying for it.
Next.